Hey, it's Peter Morley, your patient advocate. I'm so delighted to be here today with Congressman Eric Swalwell of California's 15th District.
Of course, Peter, and thank you for your continued activism. You are fighting for the health of every American. And I wanted to use this opportunity to talk to you about a healthcare issue that I'm passionate about, and that's genetic testing. There are about 75,000 different genetic tests that represent approximately 10,000 unique test types that cover 4,600 disorders. So genetic testing has the potential to reduce the diagnostic odyssey for children with rare diseases. And as a parent, and as someone myself who had a rare disease when I was a child, it took months for us to figure out what I had. And today, we are able to, through genetic testing, really end that frustrating, costly odyssey time. So the average length of time from symptom onset to an accurate diagnosis of a rare disease today is 5 years. That's critical time for parents to go to the doctors, spend money on prescriptions and treatments, and face, the rising cost of healthcare. So genetic testing is able to cut healthcare costs by facilitating better diagnosis and the consideration of certain preventative measures. Sadly, tragically, right now, this technology is available, but many of the tests are not covered by insurance providers or the Centers for Medicare and Medicaid Services, known as CMS. So I have legislation that would solve this. It would provide federal reimbursement for genetic testing for certain children on Medicaid who have an unresolved disease that is suspected to be a rare disease and is suspected to have a genetic cause. And so this would allow every child in America covered under Medicaid, to receive genetic testing that would end that odyssey and get them to wellness as soon as possible. So for Healthcare Awareness Month, I just wanted to advocate for that legislation. And again, Peter, thank you for all you're doing, not only for yourself as a model for how we can fight for our own health, but what you do to fight for the healthcare of all Americans.